Hi there, friends. Very happy Thursday to you. Thank you so much for joining us for this Health Yes Talkback segment with our friends from Genesee Health Plan. I am joined by Jim Milanowski, President and CEO of GHP, and today also Kay Dorr, who is the Chairperson of the Genesee Health Plan Board of Directors and the Genesee County Board of Health and Mundy Township Trustee. So thank you both for being here. So many times, if you've never joined us, we've been here with our friends with Genesee Health Plan now for, it's probably been over a year at least, where we talk about all these different resources that they offer, how you can become involved with GHP, what services, everything from mental health to medical to dental. But really, it's rare that we kind of go back and talk about what Genesee Health Plan really does. So that's what we're doing today. So I'm going to kind of recap in case you missed our segment at 9. What is the Genesee Health Plan?
We provide a health care coverage to people who have no health insurance, whether they have a job that they just lost and lost their benefits, whether they work 1, 2, or 3 jobs and they don't qualify for coverage at their employer, or they might not qualify for one of the like Medicare, Medicaid. We have a lot of seniors now who don't qualify for Medicare because they didn't pay into it or they work for a faith-based organization. They qualify for the health plan. We provide a basic health care coverage. So the things that you mentioned, seeing a doctor, prescriptions, medical supplies, labs, x-rays, all those things. We provide that type of coverage for people so that they can have a medical home and prevent further illness from happening.
Okay, and in the past also, and I'm sure we'll talk about this in a moment, but we've had folks on that have, have benefited from the health plan that have had life-saving mammograms and, medications and things like that. So it's really, really wonderful. To have a resource like that in our community. And, how did it get started? How did Genesee Health Plan first get started?
There was a movement in the early 2000s. The Granholm administration was pushing this, where they were looking at the uninsured in our community. This was prior to Obamacare. This was a long time ago. And not only in our community, but statewide, there was close to 1 million people that were uninsured in Michigan. And so they set up these county health plans throughout the state of Michigan, put aside some funding for that. And then, so we were one of 26 county health plans. Genesee County, there's one in Bay, one in Saginaw, and there were others that were created that represented about 70 counties in Michigan. And providing basic coverage for people, health care coverage for people. Different things that would be covered depending on how much funding they had, but there was this network. So we were one of those that got started in 2001. Then in 2006, we were concerned about we were getting increased enrollment. We were getting up to 28,000 people at a time wanting to be on the health plan. So we went back, or we decided to go for a health services millage, countywide millage that to help pay for that cost because those resources had gone away, and so we had to make sure that this was sustainable, and so the taxpayers approved it in 2006 and then renewed it in 2012. Which is a cool thing. It was that this county, this community cared enough about each other to have this health service millage pass. But so that's kind of the history. And so we've been all along serving 28,000 people until Obamacare came, and then that really had a shift in what we did.
Sure. Now, Kay, you are here because Jim says that you're his boss.
That's right.
So that's why he's
So I'm on my best behavior today.
That's why Jim's always on good behavior. That's why she's here. But tell us a little bit about, your tie-in with Genesee Health Plan. How, we talked a little bit about sort of the checks and balances system and the 9 o'clock show, right?
Yeah, one thing that I'm really happy to be serving on the board of Genesee Health Plan because the oversight and the transparency is incredible. And I think as taxpayers, we all want to make sure that every dollar we're paying in is coming back to serve the people in our community. And with that oversight, there's incredible oversight. We have an external financial audit every year. Jim comes and presents to the Board of Health, and I serve on that as well. and he also presents to the county commissioners. He's in the community constantly. And we have a board of directors that really represents many of the organizations and the talent in the area. So he gets a pretty good grilling about everything and has always come out smelling like a rose. So
that's why he doesn't sweat it out too much when
there you go.
interview him. Right?
Yes, cross my fingers.
Let me get to some of your questions. Julia says, who does Genesee Health Plan help?
Wow. So again, it's a wide variety. Sometimes we think the uninsured are homeless people or poor people. It's a lot of different people. It's people who, again, like I mentioned earlier, who work 1 or 2 or 3 jobs, part-time jobs where they don't qualify. Their employer has a certain threshold of hours that they can work, so they're not eligible for benefits. It's people who lost their job and are now in transition. So they're trying to find coverage. They're trying to find a job, and we can help cover them in the meantime. There are seniors that, that are 65 and over that don't qualify for Medicare, and that seems to be a growing area. Right. They didn't pay into it. You have to pay into Medicare in order to receive it. And then they work for faith-based organizations that are tax exempt, and Medicare, they don't have to pay into Medicare.
Sure.
And so those are the folks that we help. We help also people that don't qualify for our health coverage, but we have so many other programs that we've mentioned on the show, so we almost can help anybody in Genesee County.
And if I can tell a short story, I know someone 2 years ago, her husband died, and she was a year and a half away from Medicare, and she thought, what am I going to do with this bridge? And I was able to send her to Genesee Health Plan, and she had that bridge so that she could make it and have the care, because she worked for a very small company that didn't provide health insurance.
I didn't even know that, so
well,
that is
even
a good
something
story.
like that.
Yeah.
Well, this is a private Facebook message that asks, my grandma does not have dental coverage. Can you help her?
Yes. One of the things that, and we've talked about dental before, it's senior dental on this segment, is that Medicare doesn't cover dental coverage unless you buy a Medicare supplemental to do that. And so, yes, if a person qualifies for coverage, we can provide them through the Genesee Health Plan a dental coverage. Fillings, x-rays, cleanings, all those things, simple extractions. So contact us, go on our website, call us to see if you qualify, and then it's a very simple sign-in process.
So we kind of went over this one already, but maybe we can recap just how Genesee Health Plan got started. It was back in 2001.
Yes.
And then it eventually, you had a millage, right? Eventually after some time.
2006.
Yeah.
Okay.
So no, it really, we started off with just a few thousand back in 2001, and then through 2014 we had 27,000 people on the health plan. We don't have as many now after the Affordable Care Act, Obamacare, but we service that many people with all the programs that we do a year. So it's almost like we serve the same numbers, just in different capacities.
And have been able to expand some services to dental and things like that,
correct.
Things that people really
Mental
need.
health.
Right.
That's another area that, locally we have a great community mental health organization, Genesee Health Systems, but they are so narrow in the population they can serve because of funding requirements. So we're able to actually give them some dollars to see uninsured people who need mental health services. So, yeah.
Now this next question, I'm sorry, I don't know if it's Caitlin or Katie Lynn, but it says, what is a county health plan? Those were started in 2001. It's not insurance. So it's not insurance, it's not Medicaid. These are what we call coverage programs. So basic health care, seeing the doctor, prescriptions, x-rays. So, Saginaw County has a health plan, there's a Bay Health Plan. So if you live in those areas, there are resources like that available. There aren't many of those county health plans anymore. There used to be 26. They're down to, I think there's 6 or 7 of them now. And what happened was, prior to 2014, there were federal dollars available to Michigan for uninsured care. And so we were able to get those dollars through the hospitals in each of these counties to provide this county health plan. Well, with the Affordable Care Act legislation, those dollars went away. And so we were fortunate to have this millage that helps us provide this coverage. Other communities do not. So these county health plans are kind of dying off because they don't have this continued funding like we are fortunate to have
in Genesee County, and that's huge. But yes, there's a Kent County Health Plan, there's a Washtenaw County Health Plan. There's still a few of these around.
And I think we should be really proud in Genesee County because we take care of our own. I mean, people pay taxes with the idea that we want to benefit our neighbors, our community, and they can see that very clearly. And we've had bipartisan support. And we don't see that often in these days, bipartisan support, but we've had good support. We in Genesee County take care of our neighbors and our family.
Yeah, it's wonderful. Sheila says, what does Genesee Health Plan have to do with Obamacare?
Well, it really shifted a lot of what we did. Again, in 2014, when this became the law of the land, we had about 27,000 members, and some of them did qualify for two aspects of Obamacare. One was what they call Obamacare, or the marketplace enrollment. And so what we did, and that's at a higher income level, so many of our members shifted into that, and we helped them enroll into that. And then also, a lot of our former members got on to what we call Healthy Michigan, or the Medicaid expansion that this created. And so we were able, gosh, I remember this so vividly, because for about a year we enrolled about 15,000. So we brought people into our office, like 50 at a time, and helped people enroll into these two programs, because we don't want to cover people that qualify for other coverage. Yes. And so we assisted them in doing that. And so right now what we still do is we provide that enrollment type of service if people qualify for that. So we don't get funded, or we're not part of this, but we help people still enroll into Healthy Michigan, the Medicaid expansion, and in an Obamacare still.
Yeah. The goal is to put people where they best fit. We want to get them health care.
Absolutely.
And so there's not duplication.
Right, okay. John says, what is Healthy Michigan? Do other states have it?
Yeah, so that's what we call the Medicaid expansion. And yes, not all the states. There are some states that are still currently trying to decide if they want to do the Medicaid expansion. I think they're kind of waiting to see how things shift out in Washington. But that was, we talk about, there's a lot of talk about Obamacare, pros and cons, and it can become a real heated topic.
Right.
One of I think the good things about the Affordable Care Act, Obamacare, is that there was this Medicaid expansion, because we're fortunate in Genesee County to have this Genesee Health Plan, but we're like one of the only counties in the country like this.
Right.
The rest of the country, rest of the state, do not have those resources. So uninsured people got coverage in that Healthy Michigan or that Medicaid expansion for the first time, a lot of times ever. So that's been the positive thing about Obamacare, is that it really gave coverage to 600,000 people in the state of Michigan on this Healthy Michigan, and millions nationwide. There's still a lot of work that needs to be done in healthcare, and we probably could talk about that for hours. Yes. But that is one of the positive things.
Wonderful. No, we already touched on this too. To recap, we'll go back to this question in just a moment. But for those of you who are just joining us, we're talking with our friends with Genesee Health Plan about how the funds are used, how they got started, and the impact that the plan has made on the community. And so feel free to leave your questions, or if you don't feel comfortable doing that in the comment section, you can always private message the TV5 Facebook page. And like I said, we talked about this in the beginning, but Connie asked who provides oversight of Genesee Health Plan.
Yeah.
And Kay is one of those folks, right?
Yeah, and I mentioned a little about that before. I'm really honored to be able to chair the board for Genesee Health Plan. And in addition to that, we have an audit every year, an independent audit, and that's always come back clean and nice. We report to the Board of Health, where
what is
I
the
serve.
Board of Health? You're the chair of that as well.
I am the chair of that. That
there?
consists of 3 county commissioners. Usually we have a physician, in this case we do, and someone else who has a lot of experience in maybe research public health, and that would be me. And so we have oversight of what we want to see in the county, and what kind of taking the temperature all the time, the thermometer, or what are the challenges in the county, who's not being served. And so we're really excited to partner with Genesee Health Plan, because frankly we're concerned with the goal of how this gets done. And if we've got a partner like Genesee Health Plan who can accomplish this in a way and partner with us so that's done, that's just win-win.
So these millage dollars are collected every year through the property tax millage. And so then the county comes to me once a year and says, okay, this looks like it's going to be the amount of the millage this year. How are you going to spend that? So, I have to project what our claims are going to be, how many people we're going to serve. then that gets turned in and then approved by the Board of Health, the Board of Commissioners, and then I report out every year. Did we meet those targets? Who did we serve? What types of services were provided, et cetera. So, and then they're very interested in this audit and all that. And on our website, at GeneseeHealthPlan.org, there's a whole section on this whole issue of transparency. And we put our tax, income tax form on that. Every business has to do one. It's called the 990. So people can go on there if they want to, and it's millions of pages, but they can look at how each dollar is used at Genesee Health Plan.
And if I could add, we talked about the reporting to the county commissioners, reporting to the Board of Health, but the board at Genesee Health Plan has just an incredible, number of people on it that have talent, from financial officers, from some of the health centers. We have physicians, we have dentists, we have people representing different demographics. So there's incredible oversight there as well. And every meeting we go to, we look at the Excel sheets, we look at the numbers, and so we're keeping a close eye on every dollar.
Absolutely.
Wonderful. Samantha says, is this a new millage?
Okay, so there's a health services millage, and we just got approved to go on the November ballot to be a county-wide millage. It's a health service millage that was passed in 2006 and renewed in 2012. It's up in 2019, but we're going to go back here in this election because it's a main Genesee.
November.
Yes, in November.
Right.
And so it's a renewal. And this gets really technical, but it's a 0.98 mil, so it's not a full mil, it's a little bit less than that, which equals to about $100 for every $100,000 value of the home, right?
Per year.
Kay? Yeah, per year. So it's like $100 that someone has if your value is at $100,000. And those go to the county, and then they pay us in this agreement and with that oversight. So it's not it's a renewal of what people already have been paying.
Okay.
And financially, it's quite a deal, because when you deal with things preventively, you end up saving money. When you send someone with an abscessed tooth to the emergency room, then you're really paying a lot of dollars
The
out.
other thing is, too, is people may not know when they go to vote for this millage renewal, or, well, this isn't really impacting me, or, for the folks that they do approve it, that's great that they're taking care of their community, but for folks who may not think like that, you never know when you're going to need it.
Absolutely.
Yourself.
It's like a security blanket. It's
right.
a safety net. But it's interesting. Since 2001, we have covered 90,000 people,
Wow.
unique people on the health plan. So if you look at the census data, 450,000. That's almost 1 in 5 people at
right.
one time or another have been on the Genesee Health Plan. When I go speak, I was at a breakfast this morning, and I always ask the room how many people have been on the health plan or know of somebody on the health plan, and over half of the room always raises their hand.
Right.
So you're right. I might not need it personally, but I probably know a neighbor, a friend, a coworker that uses it. And so, it has certainly made an impact.
Carol says, does my tax money pay for GHP staff?
No, it doesn't, as a matter of fact. There's
Yes.
some state match funds, there's also grants and things like that, but every dollar of that millage goes to Health Care Services.
So when a GHP member goes to the doctor, let's say, or fills a diabetic medication or has a mammogram or whatever, that provider bills the health plan through their billing service. Then the billing service says these many claims that are there for medical services, and then we pay those, and we use those millage dollars 100%. So all those dollars go right to those claims, and then, as Kay mentioned, we use grants, we use other dollars that we've gotten through matched dollars to pay for our staff, pay for me, pay for our building, all of those things. Those are separate and are kept separate.
Okay.
Absolutely.
Yes.
Diane asked, do you work with other organizations?
Boy,
Yes.
absolutely. Like many people in the community, I wear a lot of hats. So I'm serving, as an elected official in Monday Township. I serve on the Board of Health. I'm amazed how I see health plan everywhere at the Chamber of Commerce, working with the Crim Foundation, working with the Greater Flint Health Coalition, the medical centers, because I think there's this idea that we don't want to duplicate. We want to work together because we can accomplish a lot more. I mean, Jim is a brilliant guy, but all of us are smarter than any of us. And so we want to, wrap our arms around everyone in the community, so we're working together.
I think Kay brings up a good point. The working together because there's so many times where you're in your community, you're in your own organization, you just want the dollars for yourself and you want it. But that doesn't make any sense. So what we do is we partner with other organizations that might do a service that's better than ours or we don't offer, or they get a grant but we can work on it, or we get a grant and they can work on it. It's using our dollars and stretching them so that we can work together. And face it, we've had some issues and things that we've been working on over these last few years, the water crisis being one. The last segment we did was on this registry, and so we're a big partner with that on getting people enrolled into the lead registry so that we can see what the long-term effects of this lead was on our population.
John asks, how does this impact Mundy Township? And you're a Mundy Township trustee.
Right, and I think sometimes there's this idea that the health plan only serves people in the poorest of the poor area, and actually that's not the case. Mundy Township is not the poorest of the poor area. For those of you who don't know, it's directly south of Flint, it abuts Flint, but in our area, it covers like 1,000 people out of our 15,000 people. That's a lot of people between jobs, or maybe they're starting up a new business, or maybe they just turned 27 and they're no longer on their parents' plan. So lots and lots of people in the suburbs are on Genesee Health Plan, and it's serving a lot of people.
Yeah, we had that question earlier about the impact of Obamacare, the Affordable Care Act, on Genesee Health Plan. We've seen a dramatic shift where a lot of, well, I would say about half of our membership prior to 2014 was kind of centralized in Flint Township, Burton, kind of that whole strip down the what we call the 69 corridor. Well, since the Obamacare, a lot of those folks have gotten coverage on other plans, and so now there's been this dramatic shift to areas like Mundy Township and Clayton and Goodrich and Clio and all of those. That's where our membership primarily is now versus what it used to be.
Carol asks, why do you focus on prevention?
Well, it's a lot, I think you just mentioned it's a lot costlier, a lot less costly to prevent something from happening than to pay for it at the other end. So let me explain that a little bit more. So if we can help somebody from not having a serious illness, then they're not going to go to the emergency room and spend thousands of dollars that they likely are not able to pay. That their insurance might not be able to pay, and so it makes sense. Or it's always good to prevent something from happening. Plus, it makes you feel better. When we've talked about this on these segments about not establishing this primary care home, and that our medical care is episodic. That we just go to the doctor when we feel ill, or we go to the emergency room or urgent care. And that it's costly, and you don't establish that relationship with the doctor, which is so important. So that's why preventive care is so important. We help women who can't afford a mammogram or Pap smears. We get those done for them and get those paid for, so they don't. And I hear story after story from people who say, "God, I caught my breast cancer." Way ahead before it got more serious and where more radical treatment is needed.
It's the difference between life and death in some cases, aside from being more economically
absolutely.
Visible.
Sonia asks, what is the premium for GHP?
Well, there's no premium. So again, we're not health insurance where you have a premium. We do have copay. So people are responsible when they go see a doctor or a specialist or get their labs or x-rays or a prescription, anywhere from $3 up to $50 for an outpatient procedure done at a hospital. So it all depends on what the procedure is. Those are all on our website, GeneseeHealthPlan.org. You can see what the copays are, but there are no premiums.
Judy says, I live in Goodrich. How does this affect me?
Well, again, if you're a Genesee County resident, and you might be able to be on the health plan. So it or your family. So depending on income qualifications and where you live, but Goodrich is a good example of folks that we help and assist. So not only on our coverage, but we have a number of different other programs. We've talked about our grandparents raising grandchildren support group. We've talked about our senior dental program. All these things. So a person in Goodrich or other communities could benefit from this. Now, it goes back to that issue about the millage. It's a countywide millage, so we ask the people in Goodrich to help support this, but it helps people in Goodrich as well.
Right.
We help hundreds of people to
Genesee
thousands
County.
of people. Absolutely.
All
in
right,
that
thank
area.
you both for being here. Jim Milanowski is the President and CEO of Genesee Health Plan, and Kay is the Chairperson of the Genesee Health Plan Board of Directors, as well as Genesee County Board of Health. And if you want to reach Genesee Health Plan, you can call 1-844-232-7740 or visit GeneseeHealthPlan.org. And if you want to leave your questions here, even after this live video has ended, either someone from TV5 or someone from Genesee Health Plan will answer those questions throughout the day. Thank you so much for joining us. Have a great rest of your Thursday.